seborrheic dermatitis. So what is seborrheic dermatitis? This?
Yes, so the exact cause of seborrheic dermatitis is unknown. Like with most of hair loss conditions and scalp conditions, they are unknown. That's why we need to dig deeper and deeper. But it is believed to be the overgrowth of the yeast Malassezia. It's a kind of yeast, and it's found usually in skin. And of course, when certain factors like stress, hormonal changes, certain medical conditions can trigger it, and it will come out like a seborrheic dermatitis. So how it's look like exactly in the picture, it's red, scaly, and the oily patches on the scalp. It's found on the face and sometimes other area in the body. And it affects all ages from infants all the way to 30, 40, 60. Even like my daughter had kind of seborrheic dermatitis for babies. It's called actually cradle cap. And it took me 5 months to get it on control. And I am a trichologist, but it took me 5 months to get it under control.
Yeah.
Yeah,
Sometimes it's hard. Sometimes, you have to work around it, and until it clicks, until, you finally get it under control. One of the things that I also like to mention about seborrheic dermatitis is, the yellowish type of dandruff that is quite unique from sebderm, instead of, for instance, psoriasis, which is always silvery, always white. You don't see that yellowish type of dandruff. And, that's one of the things, people confuse seborrheic dermatitis with psoriasis so much is, you have to differentiate this. One is dry, the other one is oily. Simple. And with the dry one, if you pick them, you might bleed. You do not see that with sebderm, with seborrheic dermatitis. If you scratch it too much, you're gonna hurt yourself. You're gonna cut yourself. Yes, but other than that, you will not be able to see blood after you pick on your skin with seborrheic dermatitis. And again, these two types of scalp conditions, you may see them as autoimmune disorders, genetic, autoimmune, and also they can be triggered by many things. Carrie, on your experience, what have you seen with the seborrheic dermatitis?
Yeah, exactly what you said. I see it quite often more with clients going through hormonal changes. So, well, yeah, it's those little triggers. Exactly what you said. I'm not going to repeat what you said. So,
yeah, we have also with sebderm, specifically one of the things that I've been able to find with my cases, and I get a lot of sebderm because I'm in the tropic. I'm in the heat, baby. So over here in the island of Puerto Rico, we have a lot of moisture, a lot of heat, and it is quite common, I'll say. I know that maybe in Canada, you have more psoriasis than maybe sebderm.
I guess so.
Yeah.
Should be.
That's the thing, with depending on where you live, you may see some conditions, more commonly than others. Over here, sebderm is, like rice and beans everywhere.
Yeah. And
so,
I have a couple of treatment options that I was reading about this morning for sebderm, and it's really interesting. So since sebderm is a chronic condition, as we said, so there's microbiome targeted therapies, which is basically probiotics to the skin. You know how we have probiotics and prebiotics for our gut? So it's the exact same thing. It's just for the skin. So they actually are called microbiome targeted therapies to restore the balance to the skin microbiome and alleviate the symptoms.
It's amazing that. And one of the things that I like what you just said about, have a healthy microbiome on the scalp. It's very important because, you have the Malassezia, you have the Demodex, and many other types of bacteria that are needed in our scalp. Yet when these microorganisms grow in large numbers, they create havoc, and that's the thing. We have to eliminate the excess of it, because if we eliminate them completely, then we throw off balance our scalp. And That's huge. That
Yes.
is huge. Whenever we talk about keeping the microbiome on the scalp, it's very delicately balanced, specifically with pH levels. I cannot even begin with this discussion because whenever you go, whenever you go to maybe the pharmacy, the supermarket, or even a beauty shop, you see thousands of bottles of shampoo, right? But do they test the pH level for those? Do they show pH level numbers? Not many. And the fact of the matter is that most of the products that we have out there are very, very alkalinic to the scalp.
Mm-hmm.
One of the things that we need to consider is that the scalp is balanced at 4.5 to 5.5 on the pH level scale. And most products that we find on the shelves, they're about 9 and 8 on the pH level scale. So it is alkalinic, and most of the time, what that will do, it will dry your scalp like crazy. And you would say, but Serge, that's what I want. I need to remove the oils from the scalp. Yes, we need to remove the oils, but what if we do it inversely? Let's reduce the pH. Let's use more acidic type of product instead of alkalinic.
I love that you say that. Okay, I had done a I used to teach for Matrix and for Davines, and I actually did a presentation on pH with another colleague of mine. We have to do a topic on this. I think we need to do a whole video on this because this is amazing. It's funny because the whole acidic, I always tell my clients put lemon.
Oh,
Lemon is because it's your acid bouncing it out. I love that you said that. Sorry, I had to jump in because I'm getting excited.
No, and the same thing with, for instance, apple cider vinegar is one of my favorites.
Yeah, apple cider vinegar.
That's one of the ways that you can get rid of excess bacteria, Malassezia, Demodex. You can get rid of those, by using that, and it is acidic, and it's going to help balance that pH level on the scalp. So the thing is, whenever you're thinking about treatment, for instance, one of the things that I like to do for my customers is I like to use a 2 shampoo treatment. I like to use a acidic treatment, acidic shampoo, to treat the scalp, and I will use a second shampoo, but to dry for dry hair, to balance the moisture after I remove excessive amounts of oils. So that way I can, balance the equation here. And I love using conditioners and moisturizers to the scalp, particularly whenever I'm dealing with sebderm or psoriasis. Because these types of condition, whenever you're removing dandruff, I mean, you're going to use heavy stuff. You're going to use, strong products to remove those scales out of the scalp. So you're going to dry the scalp intentionally. All right. Since we already know that that's going to happen, then I intentionally moisturize to counterbalance the effects. So that way I can get, I can get the cleansing at the same time I'm getting the moisture. And once that flare-up has been under control, I get the harsh ingredients out, and I stick with, a level of moisture less intense than the one that we were using before. So we're keeping it cool, we're keeping it calm. And incredibly enough, there's a correlation between pH and moisture, an inverse relation. So the more moisture, the lower the pH. The more dryness, the higher the pH. What do you guys think about that?
Yeah.
Nailed
Interesting.
it.
Yeah. Interesting. You said I want to talk about the apple cider vinegar thing. Actually, how I did solve the problem of the cradle cap for my daughter is actually using apple cider vinegar.
Yeah.
We did apple cider vinegar baths to kill off the bad bacteria on her skin and scalp, because also eczema is very related to cradle cap. Most people who have eczema will have cradle cap. I mean, babies. So anyway, we did the apple cider vinegar to kill off the bad bacteria and give her probiotics specifically targeting the skin. So we counterbalance basically what we're doing. And as you said, exactly after the ACV bath, she will be so dry and so scaly, poor baby. And then I will just drench her in a really good moisturizer.
Yep.
So this way, after 3 or 4, actually it took us maybe 6 times, we started to balance and started to counteract that cradle cap and the eczema in her skin.
It's amazing. One of the other things that whenever you're dealing with, for instance, subderm, there are 5 different factors that I always like, to pay attention to. Number one, stress. If you're under stress, if you're stressing, if you're going through hardship, you need to watch for those, and you need to find ways to manage. What are some of the best things that you guys like to recommend to manage stress? Carrie, what you are a stress expert.
Yes. Carrie
What
is the
what
best
are
one
the
to
things
say
that you like to do with your
Mhm.
customers? You teach them.
Yeah, stress has a lot of things. First, I pinpoint what type of stress you have. I categorize my stress in 4 factors. Intake stress, so anything you consume, environmental stress, so everything that's happening to you around you, that's that day or that week in that particular time. Was there a trauma or a residual trauma that was triggered recently that hasn't been addressed, or if there's been a physical stress that you haven't been aware of. And a physical stress could be from tripping and hurting yourself to even the way you hold your body. So for example, sitting on your computer all day causing tension in your shoulders causes stress. So really pinpointing the type of stress that it is first, and then kind of trigger. I usually have them analyze within a week or 2 of when things started to happen, when things were changed, kind of like the journal. Like, was there anything out of character that happened? Is there anything out of routine that happened? Is there food that you don't normally have happened? And kind of analyze it so we could pinpoint it the best that we could.
Yeah.
Or like hormone, and even personal stuff like hormones. Like, are you menopausal? Are you going through puberty? Are you, there's a lot of triggers, right?
Yeah, like stopping or restarting the oral contraceptives, or upping the dose or lowering the dose. All this all causes the hormonal changes in the body.
Stop nursing. Stop.
Right, exactly. Oh yeah, of course. The postpartum hair loss. I should talk about that.
Hey, and I have to throw in something for cradle cap. When my kids had cradle cap when they're younger, I actually saved a lot of my breast milk, and I used breast milk on it. That helped quite a bit. And tea tree oil.
You know why? Because breast milk has the best bacteria. It is. It's a probiotic. It has. We are all made of bacteria. We are 3 million cells of 3 million bacteria, kind of bacteria, whatever the number is, but it's kind of in the millions. Anyway, your breast milk is very compatible to their microbiome and skin microbiome. That's why they use breast milk. It's just perfect. You just said that.
We
And
even
also,
had my lactation expert. So my son Hendrix, actually, he had pink eye. My daughter, I was nursing at the time, and my lactation coach, she actually came, she like put some of the breast milk around his eye, and he was 2, almost 3, and it cleared up his eye completely. I was like, wow, breast milk's magic.
Incredible. There's a market for people buying breast milk, and the thing is that they're using it for lotions, shampoos, and even to make soap out of breast milk. And yes, my sister-in-law, she was doing it. She started a business using breast milk, and doing soaps out of it. And I will tell you that those soaps were medicinal. I mean, the skin becomes smoother, shinier. Any inflammation goes down quicker. I mean,
it is the best bacteria you can ever ask for.
Because that's the thing, it's again, it helps moisturize, it helps reduce the pH level on the skin. So it's a win-win. It's a win-win in there. So we were talking about stress and stress techniques. So one of the things that I always like to mention to my customers, go for a walk. Go for a walk, do workout, meditate, pray, what you like, do what you like, but yeah.
I always tell them to do things that bring them joy, that they get lost in time. And it can't be TV. It can't be radio. It can't be something that creates noise in the thought process. It
Yeah.
has to be something where you get quiet in your own mind. And a lot of people are like, I can't meditate, it's too hard to fall asleep. I get it. I fall asleep when I meditate too. That's why I make jewelry. You got to do something that helps you get in the state of mind. Go for a drive, do something that fills your cup, that type of activity that is soul food. Like our souls need food too. And that's,
Yeah.
doing things that really light you up, like going out with friends, just doing an activity that brings you joy. Like for myself, like I could come home from a long day's work, long day's worth of work, exhausted. I'll come downstairs and I make jewelry. That's my mindful practice. I'll make a necklace. I tell you, it's like I had 10 cups of coffee. I feel really recharged, relit. And kid, I gotta tell you guys a story. This is an incredible story. I tell people to do things that bring you joy, even if you're tired, push through it. It's kind of like Sergio talking about counteracting the balancing the pH with alkaline and acid. Well, I went out during COVID when we were allowed to finally go out. My girlfriend was an RN at the Misericordia Hospital, and she was working through COVID, and we were finally allowed to have 6 people go for dinner. So we're like, hey, 6 different people, let's go out for dinner. And I remember I was sitting at the table and my girlfriend walked up and I didn't even know it was her. I didn't even recognize her. And I looked at her, I'm like, and she sat down in front of me. I'm like questioning her and I realized who it was. And I said, why are you here? You need to go home. Like you look like not healthy. Go home, go to bed. And she looked at me and she said, Carrie, you know what? I just need some soul food. I need some of my friends to pick me up. And I kid you not, we have pictures from before and pictures after. And so we had our dinner. We had a lot of laughs. We had fun. We enjoyed each other. By the end of it, it was like she had a makeover.
Yeah.
Right.
She glows afterwards. Being with human contact is something amazing. And, it relaxes a lot of people. A lot of people, they rather be alone, but do whatever works for you to manage your stress. Me personally, I live in an island, so I go to the beach. 30
I have
minutes
a story for you.
30 minutes anywhere in this island and you're near the beach, so that's the beauty. But the thing is, you have to work on your stress, because stress is a powerful signal.
Right.
And when it comes to subderm, it will trigger the sebaceous gland to produce more sebum. And the problem with subderm, guys, is that that sebum, when it's being produced, it gets clogged inside the follicles. And when it gets clogged inside the follicles, it gets oxidated. And as it oxidates, that sebum becomes toxic. And when it goes and draws out from the follicle to the scalp, it will burn. That's one of the things that we see with subderm. That sebum becomes toxic and starts burning the skin to the point where we start seeing the scaling. That's why subderm is so different to psoriasis. And this is one of the major features of it. So dealing with the stress is very important to help control that sebaceous gland activity. The other area that you guys mentioned was hormonal control.
Before we go there, I have a story to tell about stress reduction.
Let's talk about it.
Yes. And one of my darkest time, I was like really sick and in bed, and it was really hard. Sergio Cardona called me.
Yeah, the call of a good friend. Yeah.
He called me out of the blue. And I have been in bed for the past, I would say, 3-4 months at that time. I didn't move. I couldn't move around. It was like really, I was in a really bad shape, health-wise and mental-wise. And out of the blue, Sergio Cardona calls me. And he picked up that I was like struggling. 5 minutes, I am not kidding you, Carrie. 5 minutes into the phone call, I was walking around the house, talking like full of my lungs, and somehow he pulls me out, and somehow I am motivated again, somehow I'm ambitious again, and somehow we're doing great stuff back again. It took him 5 minutes to get me out of this.
By the grace of the Lord.
I
know that the Dino was like, hey, Sergio, when are you calling again? When are you calling again, please?
Dino was very jealous. He's like, 3 months I'm trying and I couldn't get you out. And then Sergio, 5 minutes phone call, he was just, get you moving. I was like, yes.
That's the thing, whenever you get a call from a good friend, it lifts your spirit up,
Right.
and whenever you're having, hard times, you want that call. But if you haven't heard from a friend, please pick up the phone and start calling people. Okay, this is something for you guys. You who are watching, pick up the phone, start calling people, because there's people in need everywhere. So it actually helps a lot when you're dealing with stress yourself, to call someone up, and to help out anyone out there. If getting involved in someone else's life, it actually helps you control your
things in
stress.
perspective.
Yes, it puts you in the right place. Gets you. Well, maybe I'm not doing that bad.
Yeah, you just shift your focus to something else, because when we're
Exactly.
struggling physically or mentally, we just focus, we are just in a box, and we need help of other people outside of even our family, like the people we see every day. We need
Yep,
somebody else to just pull it out of this box.
that's
um,
true.
and and at that point I had a lot of like remember we talked about this, Carrie. I had a lot of trichodynia, which is pain in my scalp, and we will talk about this in another episode, but it's actually where your hair follicles become painful, and it's called trichodynia, and it's solely because you are under a stressful
Yep.
situation. It's just amazing how our body works. It's like your hair follicle starts to be painful. Like how weird is that?
It shows that something is wrong and we need to deal with it.
I
Now,
know.
let's talk about hormonal changes, on how these hormonal changes can also trigger sebderm effects. So, Carrie, let's talk about here about a little bit about hormones. People don't take care of their hormones.
Yeah,
What's up
well,
with that? I mean, people having diabetes and they don't take care of their diabetes. They have thyroid issues and they don't take care of the thyroid. I mean, what's going on?
well, a lot of it has to starts with lifestyle, being aware of what you're eating, being aware of your body. It really starts with, being physically in shape. And, a lot of people, when they think they have to be physically in shape, they have to be in the gym forever and working out and lifting weights, when really it's 20 minutes of getting your heart rate up, 10 minutes up and down the stairs in the morning, 10 minutes up and down. It's just getting the heart rate going up. But hormones, it's, that's the number. It's usually the reasons that there are out of balance is those, you're not taking care of your body. I'm sorry, I'm going to say it. You're not drinking enough, you're not eating for your body, you're not physically exercising. Now, there are those times where, you can't help it. Yes, there are those times. And there are also too coming into hormone changes as well. For example, pregnancy, puberty, menopause, all of that does come into a factor. But if you are prepared for things coming up, it'll make the load a lot easier as well. But just being aware and open to figuring out how to balance those hormones and the new changes.
Actually,
I,
like
I, I, Go
like
ahead, Biz.
hormones, Sergio, is especially for women, mostly for women, is very very hard thing to balance out, because as Carrie said, it is all about your lifestyle and stress level, and your diet and all the things considered. But some people are more predisposed to have hormonal imbalances even before menopause. Like on even most women, when they start to hit 40, they start to feel the changes in their bodies. So I think, right. Oh yeah, duh.
But the thing is, if you start seeing the changes, why don't
Right.
you go to a doctor? I mean,
That's what I was saying.
that's one of the things that I it,
Yeah.
it gets me mad whenever I have this sweet ladies come into my office and they're not visiting their gynecologists. They're not going to their doctors. I'm like, woman, you need to visit a gynecologist. Come on.
Correct.
But
Correct. And
some are prepared to hear about it or prepared to face it. Some
right.
it's a scary topic.
I know they can be scary, but logically, if you're feeling something, if you're seeing something, ignoring it will not make it go away,
Right.
guys. So,
No.
I'm trying to get into the psyche of why people, neglect their bodies when their body's speaking to them,
I can tell
and
you
we
why.
should ask, we should
I can tell
act
you why.
upon it. What do you think that's, Biz?
I think because all the like hormonal replacement therapies got really bad media since it started to be a topic back in the 70s or 80s. When they started using synthetic hormones to balance hormones for women, then a lot of breast cancer cases started to be on the rise.
Yeah.
However, it is so till now, 80% of the population think that hormonal replacement therapies are bad. It is actually on the contrary. They don't use synthetic hormones like it started in the beginning. Now it is more advanced, and they do microdosing, and there's a lot of like devices you put on your body, the woman body, then it sees the hormonal changes during the day and during the cycle. So if they are under the care of a really good functional medicine doctor, unfortunately Western medicine doctors are not trained enough unless this is their specialty. So unfortunately, some gynecologists, they don't know how to deal with hormonal imbalances because medical school doesn't teach them how to do that. But most of functional medicine people will know how to do that, especially the one who practice hormonal imbalances. Is a very niche specialty. So they will track through the phases of the woman's cycle, and they microdose exactly what the woman need with bioidentical hormones, not synthetic hormones, like they are synthetic, but it's bioidentical. They are as near as the hormone found in our bodies. And I think my personal opinion, I am not a doctor, just my personal opinion, that all women should do that. Because menopause and premenopause are not pretty. It's not only hair, it's mood swings. I have seen it, and I have seen it in myself too.
The hot flashes, the dryness,
Right.
So many things that
Like
happen at the same time.
all the scalp conditions can be triggered just because of a lady who has hormonal imbalances. All of them. It can be psoriasis, it can be subdermal, it can be anything.
Yes.
And to add one thing before, sorry to make it long, but to add one thing, men actually do go through menopause. We don't usually okay, some men, they don't acknowledge that, but actually
even we don't like to.
Yes.
But yeah, we
we
do. Come on, guys.
Yeah, the macho, I know. But men they do have hormones as us. Of course, we are more complicated biologically speaking as females.
Amen.
But males do have hormones. Yes, we are biologically speaking, and our okay. So, but let's go back. So basically, men do go through menopause and hormonal imbalances, and they need to go to the man gynecologist. I don't know what they call it. Or
usually we see the urologist or proctologist.
Okay, thank you. Because sorry, I don't know.
Yeah, but after 40, we want to skip that visit for obvious reasons. But I mean,
the raw and honesty here, I love it.
Yeah, I know.
That's
the
thing.
We're live, guys. We're live.
But the thing is, we need to visit our doctors, no matter how uncomfortable it may feel. We need to address our hormonal issues.
Right.
If we are not addressing them, we are neglecting, and by neglecting, our body is going to suffer, and of course the hair is going to suffer. So if you care, you guys, if you're watching, if you care for your hair, start taking care of your hormones, period.
Sergio just woke up. Sergio just woke
up. So here's the thing. We talk about stress, we talk about hormones, and I mentioned there were 5 elements here that we need to take care of. So the third one will be diet. And then the thing with diet, specifically with Sebderm, is about glycemic load and about lactose, about milk products. And there's a couple of studies that shows that a high glycemic diet, and of course a high milk product diet, can increase the production of androgens, thus leading to the production of more sebum, thus leading to sebderm and many other conditions. So what do you guys think about that?
Yeah, there's a difference between glycemic load and glycemic index.
Yeah.
The glycemic index is where your blood sugar shoot up right to the sky and then goes down. No, sorry. Glycemic index is when I got so much ahead of myself in my head. Glycemic index, when the fruit actually, yes, it raises your blood sugar really very high, but glycemic load is actually the number of carbs, not carbs, without taking into consideration the fiber. So they're two different identities.
Hmm.
I'll research it more so I can explain it more.
Yeah, but the thing is, the sugars in the body will react upon us, and it can trigger those androgens. And again, DHT is produced in the sebaceous gland, and it will react upon the sebaceous gland and will create more of it. And it can sometimes, and this is one of the funny things. Whenever I see sebderm, sometimes, to say the least, I would say that about 60% of my sebderm cases will be related also to androgenetic alopecia because of the androgens in the sebum. So that's one of the things that I also like to consider. Now, Carrie, whenever we're doing the specifically the epigenetic test, we talk a lot about the diet, and we talk about those little things in our diet that can cause a reaction. So walk us a little bit about this here.
About the ingredients and stuff, like,
Yeah, how they can react and make our body. For instance, I was mentioning lactose and sugars can make our body, can trigger our body to produce more sebum. And we see similar cases with other nutrients in our system that for instance, I was doing an epigenetic test this week for a small girl. She was about a year and a half. And one of the things that the test showed us, stop eating chicken for 90 days. Like, kids only eat chicken, but her alopecia areata was being caused by maybe some of the hormones that are in the chicken sometimes, so we need to lay low on it for a little while for our body to regress, to go back to where it should be. And what do you think of it?
yeah, absolutely. Food is a huge thing. And for those that don't know, my husband is a trained chef, and I've also taken a lot of nutrition courses myself personally, so I do know a lot about nutrition and food. And
I
being
love a man who
celiac,
can cook.
tell me about it. But a lot of food, like, you have to be really aware, like, we are different chemicals, and there's chemical reactions to things, and different foods have higher amounts of stuff. So for example, like, you have foods that are higher in mineral, higher in vitamin, higher in amino acid, higher in fatty acid. And knowing those foods, and depending, and doing an epigenetics test, we can analyze what you might have to be cautious of. For example, myself, I have to be cautious of high rich vitamin K foods, because, and so once you start being aware of that and knowing, for my body, I know what I'm craving, I know what I'm not craving, I know if my body's depleted in it, because my body reacts to it. And yes, absolutely, you have chemical reactions. Chicken, it could be the tryptophan in it that's causing an effect on them. I know turkey and poultry does have high amounts of tryptophan that can cause an effect. So yeah, it depends on everybody. Like, you talked about lactose. It could be lactose, but it could be the high protein in the milk that they're reacting to, that their body's not able to break down. And epigenetics is essentially biohacking your body to heal itself, so that way you could consume these foods, unless it's an anomaly of something. There are factors that are in consideration too. But for example, as a celiac, if I've had an attack, I cannot digest produce. I cannot digest any produce. It inflames things. It makes my guts all look bad. But if my gut is in a healthy state and I've biohacked and healed my gut, I can have more amounts of dairy than normal, because I'm aware of healing my gut and using those tools to heal my gut. So yeah, absolutely. Like, food is a big factor. A lot of people don't realize. And just because you have a reaction to something today doesn't mean you won't have a reaction to it from a month from now if you've corrected it either.
Yeah.
Besides,
Yeah,
you
this is
study this, so
yeah, this is exactly going back to what we said 2, 3 episodes back. It's about your food sensitivities. So whenever a person comes with alopecia areata or any scalp condition, I will actually run a food sensitivity because it could be like some trigger in your food, and it could be the healthiest food ever. Like for example, for me, it was broccoli and cauliflower, the healthiest food ever. You wouldn't think, right?
Yep.
But as Kerry said, we are all chemical reactions and we have our unique microbiome. And as Kerry said, microbiome keeps changing uh, because it adapts to what food you're eating right now. It adapts to your environment, to what kind of bacteria you are exposed to. So and also by seasons, it goes by seasons, right? Kerry, you do the epigenetic
yeah.
testings by seasons too.
We do it by
Um,
seasons. I also too, a lot of people don't consider, and I'm Canadian, so we have a lot of people that are mixed race. So we have a lot of
right.
different nationalities. For myself, I'm French, Scottish, and Polish. So we also
Yes.
have to keep in
Yes.
consideration our ancestors. So I'm an evolution of my ancestors. So being aware of what you're an evolution of and what your current environment is. And it's, again, I'm going to say this, I should get this tattooed. It is not a one size fits all
No,
world.
not
And
at
all
all.
these
Amen.
like,
Amen.
No, no.
you gotta figure it out. That's
Yeah.
what DNA, we all have, there's not a single DNA that, like, we all have different DNA. And it's understanding that for you and analyzing that, understanding that. Like, as soon as you understand that, the world changes. Like, as soon as I understood my DNA and my body and my triggers, I've eliminated my psoriasis. I've helped with stopping the hair shed. Like, there's epigenetics.
Yes,
Oh,
right. Yes, actually, I don't know if that fits here, but in my DNA testing, I found out that I do have a sickle cell trait, not a sickle cell anemia, the disease, it's just a trait. So
Yeah.
on all women who has the sickle cell trait, we should be on vitamin complex vitamin B complex basically, and folic acid for the rest of our lives.
Just
For
so
the
you
rest,
don't develop. Yep.
because our red blood cells are less efficient by 30% than a normal person. So the amount of oxygen that carries in our circulation is 30% less. So I need to increase my red blood cells by having vitamin B complex, folic acid, iron if I'm deficient, because I, like some people are not deficient in iron because I eat a lot of red meat. I love barbecue meat, so I am not deficient in
I
iron,
think
not at
we
all.
all do in this group.
I know, not at all. Yeah,
I'm a
and
Mediterranean.
um, what else? So basically, and also the one recommendation that I eat liver and organ meats to keep my red blood cells count high. So since I did that, you believe it or not, my hair is actually looks better. Don't you think?
Yes,
It
it does.
looks better. Do you remember when I had my postpartum hair loss? It was like really in a half of the size. And just 3 months of taking vitamin B complex, folic acid, and I take, because I can't find in Florida good liver and heart, and I don't know how to cook them, or I don't want to go through the hassle, so I take them as pills.
Okay,
So,
nice.
so my red blood cells are just going up and up, and my lymphocytes sorry, my platelets, not my lymphocytes, my platelets are going up and up. So I am having really good hair. And how I know that this is working? By looking at my hair. That's my biomarker, my free biomarker.
I
Yep.
love that. Love that. Now, to end the Sebderm five main issues, the other two we already discussed them, and it's basically seasons, the temperatures. High temperatures, low temperatures can trigger these situations, and also our microbiome. If we have a disorder with our bacteria, with our funguses that we have on our scalp, or the parasites, they are gonna run and they're gonna start building more sebum into your scalp. So looking at those areas, guys, we need to understand that, you know, by controlling those 5 simple areas, we are able to reduce the events of sebderm. Those flare-ups can be reduced during the year, and we're able to take control of our bodies. So what do you guys think about those, about seasons, and of course about microbiomes? Carrie.
Exactly. And also,
Okay.
like, I
Please.
think, no, sorry. But like, I do have one more question for both of you. Do you think light therapy will be a good idea here?
I love the idea of light therapy. What do you think,
Do
Carrie?
you use it for subderm?
Yeah.
Okay.
Yeah, if I have clients, because in Canada we get the 4 seasons, but we joke where I am, we get 2 major seasons, winter and summer. And I
Yeah.
do see it when we come from winter to summer, summer to winter quite often. And I do recommend going out in the sun and exposing the sun exposure like as natural as you can. Because I know I sometimes get the subderm flare-ups too. And if like because after pregnancy I got it with the hormone changes, but they would come all over my body, and sitting in the sun, a little exposure to the sun help clear it up and control it. And same with the psoriasis as well. You can't beat vitamin D, and yes, the low level laser therapy too does help. But honestly, if I could first and foremost recommend, I'm always like, get in the sun safely.
Yep.
Safely get in the sun. So
yeah, because that's the thing, you know, for people who have either sebderm or psoriasis, the sun becomes the enemy. So you have to watch it for when are you taking that sun. You don't want to take it, you know, in the middle of the day, because it's gonna flare up like crazy.
yeah,
Now,
you got to use it as a tool, like as a tool.
Right.
You got to use it for the right amount. Like 20 minutes exposure is more than enough. I know with my psoriasis, it could either make it or break it, and just that little bit of exposure until it's healed and under control. Absolutely. Same with this.
And also, one thing to add here, also the color of the skin it makes a difference here.
Yeah.
The lighter we are, the less amount of sun we need to get all the vitamin D receptors in our skin to change the sun, the UV lights into vitamin D. The darker the skin is, it needs longer time so I mean, the color of the melanin, the amount of melanin in the skin actually varies.
The darker the skin, the
they
more
need to be out more. They need to be out in the sun more than lighter skin people.
Interesting.
Because their receptors, actually, they are less in number from people who have light skin, the vitamin D receptors. So the darker
you have to think about it, you know, as who's more prone to get burned?
Correct.
Light skin. So
exactly.
yeah, exactly.
Exactly.
So
I turn into a tomato.
yeah, you and I, we go to our under the sun, you know, in 15 minutes you're burned.
Yeah,
and I can stay longer, you know. But
yeah, me and Sergio, we can stay longer than you, for example. But somebody who has a darker skin, to get the same benefit from the sun as we did, they have to be even longer and longer.
Interesting.
This is the things, you know, that we discover here at the Hair Wire, guys. This is why you choose the Hair Wire, to get hair smart, guys.
Smart.